Hi everyone, Dr. Goodner with Guardian Paws Animal Hospital here. I wanted to take a second to walk you guys through a routine dental cleaning performed under anesthesia at our hospital. So this is Fiji, an 8-year-old Shiba Inu, and he did great for us today. I do want to note that this video will be showing the full behind the scenes, and as a result, you will see him completely under anesthesia. Know that this is necessary for us to be able to do a thorough and in-depth cleaning of all of his teeth, and that he has been completely screened via pre-anesthetic blood work and a full physical exam for this procedure. He was also completely monitored with an ECG, pulse ox, CO2 monitor, blood pressure, temp probe, and provided oxygen supplementation and IV fluids throughout this procedure. So, once everything is set up, Fiji has received his pre-anesthetic medication and has had time to get a little sleepy. We start by placing his IV catheter and then inducing him under anesthesia with an IV medication called propofol. We're then able to intubate him with an endotracheal tube. This allows us direct access to his airway so we can supplement him with oxygen as well as control the amount of general anesthetic or isoflurane he receives. Next, it's time to hook him up to all of our monitoring. He will be continuously monitored while under anesthesia to make sure he stays at the ideal plane and that all of his vital signs stay within normal limits. Now we begin the actual dental itself. We always start with a before picture. You can see Fiji has a moderate amount of tartar buildup as well as irritation at the gum line. So the first step is to begin scaling all of the excess tartar and plaque above and below the gum line away with our ultrasonic scaler. This is the exact same instrument human dentists will use when you go in for professional teeth cleaning. It's just that our patients will not allow us to appropriately clean under the gum line and in between teeth to the degree necessary while awake. In dogs with early periodontal disease, this process will cause mild bleeding, just like how people with periodontal disease can experience some mild bleeding from simple flossing or brushing their teeth. This is a sign that there's irritation at the gum line, and again makes it even more important that we're able to thoroughly clean the teeth below the gum line to get any stuck plaque or tartar out. Once this is done, we begin to polish the teeth. This step is one of the most important as it will smooth out any microscopic dents or scratches in the teeth from the ultrasonic scaler to help prevent bacteria, tartar, plaque from sticking to the surface of the teeth in the future. Next, we'll take dental x-rays. This allows us to evaluate every tooth below the gum line. We combine this with visually charting and probing the mouth to screen for any signs of permanent dental disease, such as excessive tooth mobility, bone loss, gum loss, abscesses, or masses within the mouth. If an end-stage tooth is found, we will often recommend extraction of that tooth, as it will only serve as a source of pain and infection for the animal in the future. Fiji's teeth cleaned up beautifully and no extractions were necessary, so we allowed him to slowly recover and wake up from anesthesia. We monitored him closely for the rest of the day to ensure he continued to do well. We typically recommend a full dental cleaning be done once a year for most dogs and cats to prevent permanent, irreversible damage from occurring. But of course, this is patient dependent and should always be discussed with your vet in combination with any other medical concerns you may have. Thanks. Bye.